Hello, I'm Chris Cox, adjunct faculty for the nursing program at Community College of Baltimore County, Essex campus. This is a demonstration for the head-to-toe physical assessment. This is my husband. He's volunteered to be our patient today. As I walk into the patient's room, I'm checking the environment. If he has an IV order, does the IV pump look like it's working? If he has oxygenation, does he have the right device on? I'm making sure the bed's in the lowest position, making sure the side rails are up for safety, and that he has his call light in place. I'm also making sure that his tray table is at his bedside so he can reach his personal belongings so he won't be at risk for a fall. That would include his glasses, his hearing aid, and his dentures. I'm entering the room and I'm going to provide privacy. If he's in a room with someone else, I'm going to close the curtain. If he's in a room by himself, I'll go ahead and close the door. Hi, my name is Chris. I'm going to be your student nurse today. I'm doing my hand hygiene. If I'm in a room that has soap and water, I would use soap and water. If not, I'm doing just like I am now. I'm using the hand sanitizer. Can I go ahead and see your bracelet? Can you tell me your first and last name?
My name is Michael Cox.
And your date of birth?
11/24/1958.
Terrific. Thank you for that. And are you in any pain right now?
Nope.
Okay. Do you have any allergies that you're aware of?
Not that I'm aware of.
Okay. What I'm getting ready to do is called a head-to-toe physical assessment. I'll be looking at parts of your body and examine them from your head all the way down to your toes. If at any time you're uncomfortable because now you're not in any pain, please let me know. Thank you. Can you tell me where you're at right now?
I'm at CCBC Hospital.
Terrific. And do you know what today's date is?
Today is September 25th.
Okay. Do you know what season it is or what holiday's coming?
It is fall.
Great. And those help to tell me timing, because if a person can't give you the exact date right away, that's fine. Just go on and ask another question that helps us to get us into the date timeline. Next thing I'm going to do is I'm going to have you go ahead and let me examine your eyes. I would take my pen and put it next to my pen light, measure the pupil size. So I'm checking both pupils to see if they're round and equal. I'm going to shine a light into your eyes, so I want you to just look straight ahead for me. And I'm looking for your pupil reaction. Terrific. Can you just look at my pen? I'm going to bring it closer to you to see what the reaction of your eyes are. Thank you. Pupils are equal, round, and reactive to light and accommodation, so I have a positive perla. Now I'm going to take a look at his head. I don't see any lumps, bumps, bruises, any open areas, any sores. I don't see any eczema, and I don't see any dandruff, so this is good for the skin visual. The patient appears to be his stated age when I come down to his face and his body. He also seems to be sitting erect, and he's in no acute distress. Next thing I'm going to do is I'm going to come down and I'm going to feel his pulses. I'll do them bilaterally, and they are regular, they're strong. Okay. I'm looking at the skin on his arms. The skin seems to be normal. I'm feeling the arms to see whether or not I see any edema, and I'm not seeing any edema. I can also go up here underneath of his clavicles, and I don't see any edema here at all. Good. I'm going to ask you to take my fingers and squeeze for me. Great. I'm checking your strength right now. I'm going to put my arms out. I want you to put your arms on top of them. Try not to let me move your arms. Push down against me. Good. We're going to do it on the top. The same thing. Try and push with. Really good. We're now going to move down to his lower extremities. What I'm going to ask you to do is put your feet flat on the floor. And I'm going to put my hands on your knees. I want you to try and move the right knee and then the left knee. Can you lift it? Okay, good. This one? Good. Now I'm going to ask you to take your foot and just put your heel up. And then I want you to push down on my hand as if you're doing the pedal of a car. Good. Same thing for the other one. Terrific. Can I have you lift your foot just a bit so I can see the heels? We're going to check the heels while we're down here to make sure I don't see any problems with ulceration or any sores of any kind. Thank you. I'm also going to check while I'm here, pedal pulses. And the pulses feel good. They feel equal bilaterally. I'm going to check here for capillary refill. If you were someone who had nail polish on, I would push on the end of the toe to still see the capillary refill. Good. I'm now going to lift his pants legs. I'm just looking for any open areas. He's got a scab down here, a little bit of abrasion there. And on this leg, I'm seeing the same thing. He does have normal hair distribution, so it's even on both legs. So I see you've got some sores down here. What happened there?
I was doing my weed whacker with shorts on.
Okay, thank you for sharing that with me. I'm gonna do capillary refill on his fingers now, just like we did on his toes. Thank you. And that looks good as well. You can let that arm relax for me. We're now gonna go ahead and do our assessments on the patient for the auscultation of his breath sounds. I'm gonna have you just sit still for this one. Now, when you go to this area, remember, you're gonna be listening to the actual sounds on the mannequin. We're just using the placement of where we're gonna put the stethoscope. I'm gonna come down below his clavicle here, but not into the sternum. So we're gonna be 1, 2, 3, 4, 5, 6, 7, and 8. I'm gonna ask you to sit sideways for me. A little bit more, thank you. Now on the back, I'm feeling for his spine. I'm feeling for his shoulder blades. I wanna stay between the spine and the shoulder blades. 1, 2, 3, 4, 5, 6, 7, 8. You can come down to the corner. 9, 10. Could you put your hands on your hips for me, please? I'm gonna go mid-axillary, 11, mid-axillary, and 12. While I'm here, I'm also gonna feel whether or not he has any sacral edema. You can go ahead and turn around and sit for me. So you said you had a cough earlier,
Yes.
and with that cough, do you have any mucus?
Nothing that comes up. It just, I can feel it loosening in my chest.
Okay, so you haven't actually seen anything, so for me to ask for a color.
Nope.
Terrific, good. Do you have pain when you cough?
No.
Okay. Next question I'm going to come is I'm going to ask about his bowel and his bladder, but we're going to actually do the exam on the bowels on the mannequin. When was the last time you urinated?
Maybe about 45 minutes ago.
Okay. And was there any pain with that?
No, no pain.
Okay. What color was your urine?
It was clear. I've been drinking a lot of water, so
Okay.
it was clear.
And that's normal for you?
Absolutely.
Okay. How about your bowels? When was the last time you had a bowel movement?
Maybe about 3 hours ago.
Okay. And did you notice the color of that?
Brown.
Okay. And what was the consistency? Was it
It was
solid?
It was solid.
Loose?
It was definitely
It was solid. And that's normal for you?
Absolutely.
Terrific. Now, I would go to the mannequin, I would do my auscultation. While I'm there, I'm also going to check and see whether or not this patient has any discomfort. So I would palpate after I've auscultated. Any pain when I touch you here? Any
No.
here?
No.
Anything here?
Nothing.
How about over here?
Nothing.
Great. So the pain is still not there. The patient's not having any problems when I go ahead and do his abdomen. We would now go over and do the rest of our exam on the mannequin. We've now finished with the mannequin. I'm coming back to my patient. Do you have any questions for me, Mr. Cox?
No, why did you do that little rainbow on my head with that?
I was just going from eye to eye and trying not to give too much time for the light. You can also go underneath of someone's head,
Okay.
and that just helps me to see how your pupil reaction is.
Very good.
Okay? Are you in any pain right now?
Nope.
Terrific. So I'm going to go ahead and document my findings and get the information to your physician. The bed is at the lowest position. The side rails are up ×2. The patient has the call light in easy reach. I've made sure that there's no obstructions for when he gets out of bed. His table is still nearby where he can reach his glasses, his hearing aid, or his dentures. And I'm going to go ahead and do my hand hygiene again. So Mr. Cox, I'm going to go ahead and leave you, and I'll be back a little bit. If you need anything in the meantime, you use that call light, okay?
Yep.
My husband's now also volunteered to be our mannequin for us. I'm going to put your arm down here. Bring the bed to a position that you can reach it easily. The first thing we're going to do is we're going to take a look at the abdomen. The abdomen is round. He has an insulin pump attached here, so if that was your patient, you would make sure you noted that. I'm going to go ahead and listen to his bowel sounds. To do that, we take the abdomen and we cut it into 4 sections, and then we listen to each section. Put your stethoscope on and listen before you palpate. 5 or more is going to be normal. If you don't hear any sounds, you have to stay at least 1 minute in each section. You're noting whether this is normal, hyper, or hypoactive. You have normal bowel sounds. We already talked about when his last bowel movement was. Next thing I'm going to do is I'm going to move up further. I'm going to get into his chest area. I don't see any skin problems in the area here What I want to do is I want to take a look at where we're going to find our spots for our lungs. Just take some regular breaths for me. So I'm going to listen to his lungs. And we've already talked about the position of the lungs. All you want to do at this point with the mannequin is listen for the sounds, whether they're normal, whether they're crackles, whether they're wheezes, whether they're rhonchi. Now I'm going to go ahead and do the heart. To do the heart, you have to use your anatomical landmarks, which are going to be his intercostal spaces. This is the sternum. I'm going to feel down here from the intercostal spaces. Second intercostal space, right of the sternum, is going to be my first valve. Second intercostal space, left of the sternum, is my next valve. Fifth intercostal space, left of the sternum, is my third valve. And my last valve, I'm going to go mid-clavicular, fifth intercostal space, which will bring me right about there. This is where I would auscultate the apical pulse. I can also find that location, mid-clavicular, fifth intercostal space, and I can palpate the PMI, point of maximum impulse. You will have to count the mannequin's heart rate and tell us whether it's regular or irregular. You hear S1 and S2, and do you hear any extra heart sounds?